And I now know as a doctor that my body was trying to talk to me, right? It was trying to get me to wake up. It was like saying, hello, wake up. And I would say the cancer diagnosis that I had at 43 years old was the biggest wake up call. It was like, okay, that's the breaking point.
Welcome to the Richer Soul podcast, where we share how to live in harmony across health, wealth, time, relationships, and spirituality. How do you bring them all together to live your ultimate life? The best thing is, we've got nothing to sell, just great advice from people who've succeeded and lived that dream. Welcome to Richer Soul, Dr. Jen Hewson. It's great to have you join us today.
Thanks, Rocky. I'm so grateful to be here. Thanks for having me.
And I'm excited to learn from you. We always like to start at the beginning. What was it like when you were growing up, and how much did your family and school teach you about money?
Oh boy. Well, not a thing. I'm going to be honest right off the bat. I grew up, I had a mom who was 14 years old. So my mom at 14 got pregnant with me, and I moved a lot. My mom was always struggling with money. So what I learned about money is that money's a struggle, that money is hard to, like, you got to work hard for money, that money, and I always watched my mom like kind of overspending and then struggling to like catch up. And I did that for many, many years. So I would say, the trauma as a kid, with all the moves and the partners that my mom chose in and out of, kind of her own trauma and poverty, weren't always the best. There's a lot of alcoholism, a lot of abuse happening in home, whether it was domestic violence and or towards myself. Money took me a long time to kind of get over the lack mentality of like that money's hard, and it made me a real determined to achieve, to the highest that I could, so that I didn't have to live that life of constant misery and poverty.
It's funny. I find that people who come through that lifestyle, one of two things happens. Either it it creates the desire to get out of it, or it cements the desire to stay in it. And
Yeah.
I don't know what causes one person to say, I'm not doing this anymore. I'm going to change my life. And another to say, this is my life. I have to accept it.
Well, I'll give you my perspective.
Sure.
I think God has a plan for each of us. And I think I call it fortitude, right? A lot of people are like, oh, you're so strong or you're resilient. But fortitude is the strength to overcome whatever obstacle is in the way. And so I know that my journey to be a doctor and my journey through my health journey through divorces and just poor decisions and things that I've overcome weren't just because, yeah, I'm resilient or I'm strong, but that I had the audacity to get up and to keep going, right? To get up even when it was hard. And I think some people just, it's like a nurture nature. Half of it is just nurture. It's how we were made, how we were created, and who's ever I, whatever your belief systems are. And then half of it could be, programming, lack of support lack of support of like just even from community. Even if family's no good, we have to look for support somewhere to kind of get out of that unstuckness, right? And but I could say that, Rocky, that there were some years where I was pretty stuck.
Was there something that gave you that resilience or that desire to move forward, or do you think it just was innate?
Well, I think it was nature nurture. I think half of it came from my creator, God, and half of it seeing my mom at 14. I mean, even though life was hard, even though I've never, like this woman, she would ride a bicycle, the equivalent, and you're in the US, miles, probably 20 miles at least one way from where she lived in St. Thomas, Ontario, Canada, to Eaton's, and my mom was a very beautiful young woman, but she would ride her bicycle to work at the makeup counter in Eaton's every day. Well, my grandparents watched me, and then she ended up finishing getting her RNA, even though, I mean, she tagged along, some not so great partners along the way, but I watched her be resilient, even if, and even though. And so I think my mother taught me a lot about that.
Interesting.
Yeah.
Was there an aha moment or a turning point in your life where things started to change for you? It sounded like you had a lot of trauma. I know you had some health issues and so forth. How did that all come about?
Yeah, I mean, I kind of reached the top of what you can here in Canada as a administrator in education, and was making, high six figures, like doing really well on the outside. Like I looked good, I was fit, I was doing CrossFit, but I had I ate garbage. I had a dysregulated central nervous system. I had high amounts of anxiety. I wasn't sleeping. So I was a mess on the inside. Okay. And all of that came to, and I also was, a wine o'clock. I overdrank on the weekends. I smoked socially. I was making a lot of choices that weren't aligned for, I guess, God's plan for me. And so I was 42, around 42 years old. Even in my early 40s, I started to notice more symptoms. And I now know as a doctor that my body was trying to talk to me, right? It was trying to get me to wake up. It was like saying, hello, wake up. And I would say the cancer diagnosis that I had at 43 years old was the biggest wake up call. It was like, okay, that's the breaking point. And I now know it was like a big boulder. Sometimes the universe, God, whatever you call it, will send us little breadcrumbs of like, follow the breadcrumbs. Here's some people call it intuition. Here's what I'm trying to teach you or want you to learn. But I needed a big boulder. I needed a mountaintop to come and hit me on the head, and that was breast cancer.
And that was before or after you started doing your trauma work?
That was, well, some of that early work actually, Rocky, was kind of, I would say within the first 12, a year after the diagnosis, and I walked away from kind of conventional treatments. I did a little bit of their medicine, and I was failing. And so I decided, after having this fun little test that was all about gut health, and it made such a profound difference for me. I was like, what is this? And then from there, I started learning more. I became a trauma-informed counselor through Heart Math Institute. I did a trauma counseling course because I knew that I was making a lot of misinformed and poor choices financially, spiritually, mentally, emotionally, all of the decision making and the choices that we make that always have a consequence. And a lot of the choices I was making, I knew were no that had led me to getting this cancer. I didn't, point fingers at anyone else. I guess I did a little bit there of kind of victimizing my childhood and whatnot. But I had to kind of recognize and then take responsibility and say, hey, this is my life. Like I gotta make some changes.
What was the gut health thing that you found that changed things around?
Well, it was a practitioner that a friend of a friend told me about and said, Jen, I think you should go see this person. His name's Tom. And I went and visited him, and he did a test with what's called an Avatar SC5, which can be done in person or online, and it works in the meridian system. So if we think of like medicine, we have Western medicine today, which is about 120 years old. It's based on Eastern medicine or Tibetan medicine, and it dates back to over 5,000 years. So we're working the meridian system. To your viewers that are like, what's that? They've probably heard of acupuncture. This is accessing those same points that maybe an acupuncturist or a Chinese medicine doctor might access, but it's using a pen and a system where there's no pins and needles, no pin cushion happening. And we can get a lot of information from the body, greater amounts of information than even blood work.
Interesting. So is it electrical impulses or
Yeah.
what?
Yes.
Okay.
It's actually, the technology is from the 1940s from a doctor named Dr. Vole. And what he found, and through his experimentation, is that humans have an electrical highway. We are electrical beings throughout the body. And that when you access certain meridians or electrical pathways, they lead to various organs, systems, et cetera, et cetera. And then I had a really sophisticated medical software built for the program that I use through Veridine, which is it's actually a US company out of Las Vegas, Nevada. And it's really sophisticated, and I'm really asking the body questions. And that's the test that I had done, and was able to find out, wow, like you have dysbiosis in your gut, you have a leaky gut. I had a liver that wasn't well. I had a lymphatic system that was basically not running at all. I mean, and that's, a lot of that led to getting the cancer itself, because my cancer had actually spread into my lymph nodes. So
When you say asking the body, what do you mean by that?
asking questions. So some of your viewers may or may not have heard of muscle testing. And so we can ask the body a question. I know my chiropractor uses muscle testing, right? Like when he's deciding what adjustments I might need or might not need. Some of our older viewers might know what water wicking is. Okay. So it's like literally holding a stick and you're out looking for water on the ground. Right. And people in hydro use it for when they're doing digging. So it's an ancient form of using again, it's just energy. right? And it works, and I'm really good at it because I tell I tell people all the time I'm booked until I'm dead. Like my calendar is very full, right? With doing this particular type of work with the testing that I do.
Interesting. I just had a recent thing where they were doing, it's kind of like acupuncture, but it's called dry needling. And it basically goes in and activates the muscles and gets blood flowing to them. And it's been a very different experience.
Mhm.
And it's amazing how it gets things to let go. And
It sure can.
going back to what you talked about, the body holds on to stuff and we don't even truly understand it with our Western medicine systems.
Right. Well, the work that I do with in that particular area, because I work with the body and the mind and the spirit. I work in all three. Is I what I call the foundational piece. We need to clear the pathways in the body that are clogged up with debris, dead energy, things that don't belong, excess food, anabolic, catabolic waste. So basically, we need to clean the vessel. We need to go do a good old detox and then change what we're putting in. And so, I used to define myself as like I'm a food doctor because I'm using food as medicine to heal and at least get the body into some kind of what I call homeostasis or balance. We're always going in and out of balance. There's been studies done on could we truly always maintain homeostasis or balance all the time? Actually, we die. Okay. So healing isn't linear. Like things are in and out of the balance, but we don't want these big, like, all the highs and lows in the body. So at the essence of what I do, Rocky, is I balance the systems and organs of the body using natural medicine. So they might be minerals, they might be herbs, they might be homeopathics. I use traditional Chinese medicines and I use them. I tell them they're like the teammates, the supports that help the body to do what it's not doing. 90% of symptoms that take people to their MD can be traced to the gut. So that's why I decided, as a natural medicine doctor that uses root cause medicine, functional medicine, to start in the gut, because 90% of your health, physiologically, biochemistry, we're not talking about the mind yet, is rooted in gut health, right? So you got two brains here, your gut, your first brain, your second brain. So that's why I went to that path. And like I said, it changed so much for me. I was floored, so much so that I quit what I was doing with, Western medicine and retired early and went literally on a journey to learn everything I could about how we truly heal body, spirit, soul.
And yeah, I've read a little bit about Chinese medicine. I haven't found a good practitioner, but I'm told with Chinese medicine, they literally feel your pulse and look at your tongue.
Yep,
And they
I do
can
that.
tell you quite a bit about what's going on in the body just by reading the signals. And I think our current system, we've forgotten how to read the signals.
Right. Well, there's not a lot of, and it's not anything about good or bad doctors. Okay. I have friends that are MDs, okay, specialists. I have a great friend who's an OBGYN. Their training is what their training is. That's all I'm going to say. It's a scope where they're looking this big. And if we think about, I always tell people, because they're like, well, what is natural medicine? You actually asked me off camera. Natural medicine is like how the entire universe works, right? And it's all energy, protons, neutrons, and electrons doing a little dance. Their little dance creates a vibration, and a vibratorial vibration can be measured in hertz. And so it's science, right? That's the subatomic pieces of us and everything in the universe. And so if we get into the body and we try to balance the molecular pieces of us and then the submolecular, we can make huge impacts in how we're feeling, how the body reacts and how it feels. And that's how someone that's trained in traditional Chinese medicine, that's why they can do that, because they're like, the pulse says a lot, left to right, right to left. I don't use all traditional Chinese medicine techniques, absolutely not. I wasn't trained in that method, but the type of testing that I do, if I'm just doing the testing, is from a more Eastern grounded philosophy, okay, or practice rather, not philosophy. So yeah.
And, for a lot of people, they might be struggling with this. I will say, if you think about it in the basic terms, when you have heart issues with conductivity, they put in a pacemaker, which basically creates the electrical signals to keep your heart pumping in the rhythm that it's supposed to. And yet we forget that there are all these electrical systems and signals that go out, and that's how your brain creates synapses. All of these different things are done with that, and we'll give you a chemical to change those types of electrical or block them, but at the end of the day, that's what it comes down to. You mentioned you spent some time with Heart Math. I know they've done a lot of work in that specific area. What did you learn from that?
Oh, wow. So much, so much of what shows up with patients is rooted in stress and in fear. All of it. All of that actually, exactly, you just nailed it, changes the electrical synapses, okay? That vibratory, okay, which takes things out of resonance, ideal balance, into dissonance. And if we think about disease, dis-ease, a lack of ease, a lack of balance. And so heart math and I did a trauma informed counseling certification with them. What they've shown through all their research is that when we really lower cortisol through lowering stress, and cortisol is just a stress hormone, through literally just a simple breath coherence technique, right? In for 5 or 6, out for 5 or 6, focusing on the heart as this beautiful piece of divine technology. Your heart is a technology, right? Like it powers so much. It's huge. And it's actually like part of why it's on the cover of my book. There it is. And so I really learned the importance of getting people back in their bodies, right? And spending and doing just a mindful 2 to 3 minutes twice a day, and the outcomes on heart rate variability, blood pressure, like all the things that people would be common, less things like AFib. Okay, which is, we're getting into people that are on all kinds of beta blockers and things like that. They're seeing huge outcomes with just a mindfulness practice, because cortisol, when it's high, increases all of that. And what we want is we want to lower it. And within 2 to 3 minutes of a guided breath practice, and you don't need to go and lay on mats and do for an hour and scream and yell. You can literally do it in the grocery store line, because you don't have to close your eyes. And it's just in through the nose for 5 or 6 breaths, out. And really, the ideally, if we're trying to get out of like an angry state or overwhelmed or fear or whatever it might be, we're just going to focus on something that actually a great memory, your child being born, the day you're married, seeing your first grandchild, whatever it might be. And the outcomes on lowering cortisol, raising the hormone called DHEA, incredible. And so the people that practice it and have it as part of their toolbox, I'm seeing come off of all sorts of medication related to the heart, because now they're managing kind of the root, which is stress, and instead of blocking it with like a beta blocker. Okay, which artificially kind of opens things back up instead of contracting. If we think of like stress, right? Like when we're stressed, we clench things. The same thing happens to the heart and to your actual vessels, right? Like it's all the same. On like a stress response on someone's face, the same thing's happening in the heart and to the arteries, the vessels. And so that's the biggest outcome I've seen that I could make real, physiologically real. And then if we think about the emotional and mental well-being in terms of how it helps in trauma, so much shifts when we go back to breath. So that could be another whole podcast. But with the heart in particular, that's where I see it affecting kind of, the number one, I think it might be number two right now, heart disease, right? Any heart issue in North America, diabetes, heart disease. And so both of them affected by stress for sure.
And what you eat.
Yeah, 100%.
I'm wondering, when people feel anxiety, I get it. Some people are very anxious and you feel it. But for the average person, they probably have a lot of anxiety, but they don't notice it because it's their base level anxiety, and they've been sitting in it so long, it doesn't register as anxiety. Have you found that?
Yeah, absolutely. I actually had a patient today, and and I've been working with this. He's one of these people that isn't recognizing. I talk about the 8 R's of kind of healing. We have to recognize, especially at the mind level, right? The soul level. Okay, we have to recognize what the heck is going on up there. What noise is going on? It's not the goal isn't to quiet it, but it's to sit back and just be, in kind of new age circles, they call it witness consciousness. We could call it, being mindfully reflective of like just going like just allowing the mind to do what the mind does, but actually like going, wow, like I'm thinking there's a lot going on up there. Right. And most people aren't recognizing it because they're not even in their bodies, Rocky. They're kind of like out floating. Right. It's why, all the time I can get people that have lived with atrocious symptoms for multiple decades sometimes that have normalized it. Right. They don't know what it's like to actually be able to sit in silence and be still. So many people there's a lot of quick fixes in our culture today, right? And so what it does is it creates high levels of cortisol, low levels of dopamine. And so people are constantly always wanting the next thing, or, scrolling on their phone, call it doomsday scrolling, or needing to shop, doing things that really are like instant gratification, because when they get still, it's scary, because then they're going to recognize just how neurotic their mind is. Because there's a lot of people out there, I would say a good chunk of the population, that don't realize it. And if they're happy, great. Keep it simple, stupid, right? The KISS method. If they're happy in their their neurotic minds and busy minds, that's fine by me. But most people aren't.
How do you normalize it?
How do people normalize it that are living that way?
No, how do you normalize them so they aren't living that way?
Oh, I see. So I really work on the recognition piece first. So I have a program. Sorry, I just shut that off. I have a program that I do. It's a master class. It's called the Foundations. And that's really, the foundational piece. That's why it's called the Foundations, is to get people, number one, we do all the things. We get the gut brain axis. We do the gut health. Okay. We give them the tools about the foods, we work on that. And then we look at the hormone and the central nervous system level. The central nervous system is the brain. Right. So sometimes there's hormone imbalances that need help. There really are. But I get them to normalize it, okay, or to get them back to awareness by becoming aware. And sometimes for some people, there's not a one size fits all. Sometimes it's a mindfulness practice of just sitting and listening to the mind, letting it, especially when you're in overwhelm. Because if you are, really wound tight and you're in a lifing situation where there's a lot of external noise, external pressures happening, and they happen to all. So I think, if I think about why, a lot of society, especially let's call it in Western, societies, normalize this sort of busy mind. Okay, where our mind and intellect is constantly seeking answers, seeking outcomes, expectations, right? And really, it's sort of the source of suffering, right? Where we're preconceiving an outcome before things have even come, and that's really the definition of anxiety. So people don't always see it that way because they've lived this way for so long. And I think it's become normalized because the world is such a fast-paced information, quick fix, quick hits on, like, dopamine like hits, right? Where we can go online and buy a trip. We can scroll and watch videos, how many a minute we could probably watch. And I think the average view time is like 4 seconds or something of a video if you're posting online and social media. And it's constant hits for the brain, because a lot of people, if they were to sit with the mind and listen to just how busy it was, they would really see and recognize just how neurotic they are. So it's become normalized to just go, 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 because when we sit in our stillness, we have to sit in our own stuff, and our stuff can be uncomfortable. So, and that's, I had to do that for myself, and it was uncomfortable.
People don't like sitting in their own stuff, do they?
No, they don't. I had a guy today. And I haven't fired patients before. I haven't. But there are people that when they just want to come and be a victim. And I'm a great teacher. Like, I was born a teacher. But there are some people that are uncoachable, right? Where they're like, but no, it's this. And I'm like, John, it's you. You're the problem. Right? You need to stop looking for the sky falling down on you every day. But he doesn't see it. So I gave him another book today, and he always records our sessions. And I hope he goes home and listens to it again, because people don't want to take responsibility. And I honestly think, Rocky, that part of it is We also have a medical system that's treating symptoms instead of making the patient take some responsibility for their part in their misery, whether it's their body or their diabetes or whatever it might be. A lot of people don't want to take ownership, right, and take responsibility.
How often is the answer it's not them? Like percentage wise, is it like 90% them, 10% not? Or do I have the
You're
numbers
gone
wrong?
again. Can't hear you again. I don't know what's going on.
Can you hear me
These
now?
headphones work, so I'm not sure why. I'm
I don't know. Can you hear me now? Let me see what's going on.
check, check, 1, 2. Okay, now we're back. It's so weird. I don't get it. You block out. It's like you get muted.
No, but it's showing up on my side. I'm wondering
Okay.
if your microphone has a loose connection and it's
It's
disconnecting
it's
or
pretty
something.
new.
Okay, it's in the plug correctly. Okay.
Okay, I'm
Well,
so sorry.
that's
Okay.
okay.
So that was
Nope.
a great answer. And then you started talking and you were smiling and I was like, I don't know what he's saying.
Yeah. We'll go from there and we'll finish
Okay.
the question.
Okay, go ahead.
I'm wondering what percentage of the time it's the person needs to look in the mirror versus it's outside of them. Is this like a 80-20 themselves, or do I have the odds wrong?
I'm going to say 90-10.
Okay.
90% it's them. Because there's a doctor who I'm going to be going to Rochester, New York. I'm going to be traveling to the US in June to do some really deep training with Dr. Henry Wright from the Be in Health Institute. He maintains that he says 80% is rooted in fear, stress, and anxiety. I would say that it's higher. I say a little bit higher because I just always look clinically at what I see. Getting the body back online is at least one of the three, right? We've got that. And ideally we want to have all three. We want the Holy Trinity, right? We want the body nicely balanced. We want the mind, or the soul nicely balanced. And then we want some kind of connection with something bigger than ourselves, our spirit, right? Um, that's ideal in an ideal world, but usually one of those pieces is broken for people, if not all three.
We'll get to that in a second. Before we do, I know you said you test hormones to see different levels.
Mhm.
Do the levels that you look at differ considerably than what Western medicine would say is normal or abnormal?
Yeah, so my levels are very different. I'm looking at a level in terms of not like a number of like where it should be on like blood testing or a marker that Western medicine has made up. I'm looking at, is it working hard to balance or is it given up trying to balance? So is there a reactionary effect in the energy system, or is it a stressor? Okay. And I'm really good at balancing them. I just did a woman this afternoon. I look at more than, I always look at cortisol, absolutely, because, we live in a really stressful world. And a lot of people, if there's been trauma and past traumas, there could be like what's called a cortisol drip, especially where mood's an issue. People that have had lifelong, stressful situations or PTSD, soldiers in war, whatnot, they can live with this constant cortisol drip. So I'm always looking at that, but it's more of a overworking, underworking. And then I might use some medicines, whether they're homeopathic or otherwise, not really behavior modification, but let's call it tools in their toolbox that might work for that person that they can turn to, whether it's tapping, breathing, the heart math stuff, somatic movement. There's exercise. There's so many things, right? The things that people can put in their toolbox that will also help their hormones to balance. Nutrition is number one, right? It's a stacked foundation. Nutrition, hormones, central nervous system affects your power and your performance in all of life at a physiological level. So, and most people are just still putting garbage in their bodies. I mean, obesity is like an epidemic, right? People are filling themselves full of processed garbage foods and then wondering why their bodies are breaking down. And it's not just obese. I mean, you can be a very unhealthy, skinny person too. So I see that all the time too.
That makes sense. We spent a lot of time on the body. Let's move to the other areas that you're talking about and how they fit together. So you
Okay.
keep talking about soul, but then you say soul and mind together.
Yeah.
I would have thought of them as separate.
They're not. They're the same. Your soul is your mind and your intellect.
Interesting. That's a very different viewpoint than most people have about the soul, isn't it?
No, not in my, I mean, have you ever done research on it? Like where, or are you just thinking, I think you're probably just basing it on what you think the norm is. I'm just gonna Google, like, do you use any AIs at all?
I do. Honestly, I've probably never asked that particular question. I
Yeah.
think a
Even
lot
if
of
you just
people,
Google it, I just did it for us, Rocky. A soul is generally defined as the essence or animating principle of a living being, often considered synonymous with the mind, personality, or self.
okay. I
Yeah.
I always think of the soul more so as the observer of the mind, and the
Well,
mind being the one that's doing all the blah 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 blah.
Well, I think I think I can help to make this clear. We have two things that people kind of think of up here. We have the hardware, that's the brain. That's what you're talking about. And the brain is fired up from what? The software. And that's the mind. That's the soul. And that's the part that people frequently they kind of confuse the two because and you could look at it, it's kind of like the observer of self, but the observer of self is really the brain, right? The self is the mind that's constantly the chitter chatter that can go out and, have expectations and preferences and all of those things. And the brain just computes it.
Okay.
Yeah.
So, how does that all fit into our health and what we've been talking about?
Wow. It's such a huge thing. But when I work with people on just the gut health foundationally on nutrition, what it gives the ability to do is to have that next stack foundation, which is hormones. And hormone regulation is going to just tell the brain what are the neurotransmitters, and there's a lot of them. I'm not going to get too sciencey here, that they can be okay or they can look for balance. They can seek to be okay. Now, I said a 90-20 or 90-10 rule earlier. There are genetic mutations. There are chromosomal things that come up that are going to not be related to anything of what we're talking about. But if we think of a neurotransmitter as simple as like dopamine, serotonin, melatonin, a lot of people have heard of those, so we'll go with simple ones. They can't balance without hormonal balance. Massive amounts of like cortisol hormone. It basically becomes like that's the priority in the body because high levels of cortisol, whether it's a bear is actually chasing you or your house is on fire, or you're just a high stressed out person that's living in what ifs, the body physiologically doesn't see them as different. And what it will do is it kind of relaxes the neurotransmitters to say, you're not as important. So their importance drops. And that usually means a drop in serotonin, which means a spike in anxiety, and a drop in dopamine, which could trigger a lower mood, right? So they're definitely related to having an ability to have less chatter, an ability to be less neurotic. Environment is very important too, right? So the vicinity of the people, what's the old saying, and you probably know it, you are the sum of the 5 people in your life, right? So what's your environment like? Where are you hanging out? What are you watching? What are you consuming outside of food? What are you putting in? If you're putting in a lot of fear-based anxiety, stress, I mean, I'm really particular about what I watch, who I hang out with, the invitations I accept to conferences, where I'll travel to, because I want to regulate and keep myself performing at my peak. So I'm really good about boundaries and I communicate them well. I'm not going to do something that's going to create more chitter chatter because I trespassed myself. I put myself into a situation or into a place that isn't good for me. So doing the gut piece it's like, again, it's foundational to helping the hormones that then help the central nervous system. And they definitely, I see it all the time. People do their 30 days to 60 days with me on gut health, and they, I would say 80% of them are like, big improvements, right? Some stay stuck there. There's probably deeper roots to get at, right? And we can't get all the roots in like that short of a time. I like to tell people it's like if we cut down the tree of like a lifetime of anxiety or fear, it's like when you cut down a tree, what starts to grow up are the little suckers, those little suckers are those little thoughts in your mind. For me, a great example, so that it's not so like, what is she talking about? Biggest kind of deepest rooted anxiety was a fear of people. It was a fear of being seen. Why? I didn't find safety in people as a kid. So I had a lot of trust issues with people, basically from PTSD, from trauma and abuse and things that I lived through as a kid. And it followed me a long time. Every once in a while, still, I have one of those suckers that comes up when I'm taking a stage, or I just, I just led a retreat in Guatemala last week, and the old voice came up, and I hear it from people all the time. I'm not alone in this, where it was like, what are you doing? Like, who do you think you are leading these women, like executives that are C-suite people? Who do you think you are? Right. And it was like that old sucker coming back up to try to like belittle me again, put me back in my place. But here now I recognize it. I'm like, that's not my voice. That's not even my voice. I don't have to pay attention to that. So I can, if I take responsibility for what is being emitted up here in the mind level, I can stop it. Right? I have the power to choose that. We were given that free will to do that. So I would say that it helps with that, but still people have to be the witness to it. They have to recognize, they have to see it, right? Hopefully that helped. I don't know if that helped you with that question, because these are big questions, right? For a podcast, but definitely it's how I see a lot of people benefiting from the work that begins foundationally with nutrition and in the body.
Well, and I think for whatever reason, we've created a society that lives in silos. And even work is siloed, family life is siloed, everything's siloed. And people don't understand that life is not silos. And things you do over here have an effect over here. And I don't understand why people just can't see that or understand that or comprehend that. But all of these things have to go together. And when you make a change on one side, it has an effect on the other. But yet, for whatever reason, we tend to not see that. And
I think that
it is what it is.
we've been raised, Rocky, and kind of programmed to be self-reliant. And this is a great segue into like the spiritual path, right? Is that when we lean on our own understanding, when we lean on, we're like, we have to be this silo that we're like, we are separate. We are separate, right? And that's what a silo is, right? It's just on its own. Self-reliant. And so we become, and it was me for 43 years. I'm going to do it. I've got to do it. I'm going to power through. And they will push aside their body, their health, their wellness, everything to just push through and be self-reliant and handle it all themselves. And really, we stopped caring about one another in this world, right? Through this ideology or paradigm of being self-sufficient, self-reliant. I mean, and a lot of Dr. Gabor Mate talks about it in the roots of addiction and mental health from a psychiatric perspective, and this is a scientific perspective. He says that it's the disconnection from self, so not even knowing yourself. And then I add to it disconnection from spirit, okay? Holy Spirit, from the Spirit, from something bigger than yourself. And then we become disconnected to what? To each other. Right. And so it's the three levels of disconnection that keeps us in those silos: to God or spirit, whatever your views are, to self, and then to other. And most again have all three, where there's just this brokenness, a spiritual brokenness too, right? And so we can have this brokenness at all three levels for sure. And it's a lifetime of work to work on this. This doesn't happen. It's not a 5-week course to do it. It's a lifetime of trying and training and applying principles and failing and getting back up and doing it again. And that's what I've learned with people. Those are the most successful people at finding peace that lasts, right? Are ones that keep getting back up and they try again. They don't get depressed or give up, throw in the towel. Like by now, all of your viewers have given up on every last New Year's resolution, right? I say you can do a redo. We get second chances. So you get up and you keep training. Said the word training. It's trying. I don't like the word trying. I like the word training, because training implies that there's a target, but it's going to take time to get there. So we're just training to be the best versions of ourselves. That's it.
No, that makes a lot of sense. And, if you look at the way even we raise kids, right from practically from birth, they want to keep you separated. And a baby is not self reliant. That's just kind of silly. And I don't know how we got so far off of nature, so to speak, and how things naturally occur in all of these things, but it happens. And the results are not great health. The results are that underlying anxiety that I think a lot of people don't even realize how much they feel because it's so normal. They just think even aging, people are like, oh, you get old, so you're supposed to do that. Like, no, you
So
can
true. That's a great example, Rocky. I love that example.
you can be healthy and older
That's right.
and do that. And other societies actually have a better appreciation of the elderly because there's wisdom there. And yet we seem to forget about wisdom and say it's not important, and that's a shame. So we're destined to keep making the same mistakes. But it keeps us glued to the screen and they make money, and then you wonder why they have all the money and you don't. It's cuz you gave it to them.
So true. Yeah, these are deep topics, right? Like this is, this is real stuff. Like how did we get here? How on earth did we become a broken society? I mean, I'm outside of doctoring work working on building a nonprofit for street level transition and transformational programs for people that are street level, that are clean and dry, but that are coming in, and not just to give them a bed and some food and clean them up and detox for 30 days, but they get out a 30-day detox and they come into my transformational center for a year and they work on the real roots of how we heal, right? Body, soul, spirit, because those three pieces are broken and there's broken pieces within them. We have a whole, look at North American streets in every city. We have broken people everywhere. And when it's that broken with the lowest, people who have really fallen on hard times that are on the streets, there's a lot of people that aren't on the streets that are just as broken, right? On the inside, and whose minds are just as neurotic and broken as the people on the streets. They probably made a few different choices that led to being on the street than maybe the person that still has the job, still has a home to live in, et cetera, et cetera. But we have a broken society. And I do think that it begins with, the spiritual brokenness. It's really why I wrote my PhD on. Right, I wrote it on the importance of spiritual connectedness in healing outcomes, and how people, and through the Happiness Institute, there's all sorts of research on this. It's not just me that's researched it, but my dissertation was accepted, and I really looked at healing outcomes physically, mentally, and emotionally when people were connected to something bigger than themselves, not connected to religion. This isn't about religion. This is about, okay, I believe there's something out there that loves me or that created me or whatever it is, and some people connected to religion, Christianity, Buddhism, Taoism, whatever it is, right? But in every essence, in every way, in healing outcomes from people that would consider, though there's nothing, let's call them atheists, versus someone that has some kind of faith, 100%, like the results are astounding, right? Around 86%, which is huge, right? In my studies, in what I found. And overall, it's usually between 80 and around 94% higher outcomes. Those are huge, not 100%, but those are huge higher outcomes for people that have that aren't spiritually disconnected from self, other, and to God, to God or something bigger than themselves. So it's huge. And we, as we became more secular in North America, the US still has quite a, evangelical, a lot of like more Christians. There's a lot more in the US, but here in Canada, like it became like, I don't think there's hardly any churches open left in Canada that were here 100 years ago. Absolutely not. The world moved away from that because organized religion became really scary for a lot of people. It damaged a lot of people. Right? There's a lot of fear, a lot of trespassing happened. And so it chased a lot of people from religion, but that's different than spirituality. Spiritual connectedness is not religion. So very, very different. But that's what I wrote my PhD about. The differences in healing outcomes is mind blowing. So I beg all of your viewers to just kind of go on, go on Google or wherever they go and really explore that. It will blow their minds.
And I encourage them to do that. Don't listen to what somebody says. Go do your own research and find it for yourself and figure out what works for you, because we are all different. You have to figure out the way it goes in your particular area. Out of curiosity, what do you think the future holds? Are we going to get better? Are we just going to continue to devolve? What are you seeing?
Well, I have faith. So faith is the belief in something that we can't see. And I don't put it into my hands or into the hands of man. I go back into my spiritual, into my faith, which is it's in God's hands. And I say that each person, if we all begin to take responsibility and love on each other, connect to each other. I had a profound experience just before Christmas with a gentleman on the streets, which actually triggered me to be working with a few leaders across Canada and building this mission. And it just dropped in my heart that I'm to take this work and help the most broken on top of helping like the C-suite, boardrooms and the bums. Okay. So the people on the streets need me just as much as the people that can afford to pay for my services, right? In transformational programs. So I believe that that's how we do it. Right. And for me, I'm a Christian. And so if we read the New Testament and we look at the gospel and the work of like the man named Jesus Christ, oh my gosh, like he was a rebel, right? He didn't like the church and organized religion. He was against all of them. Called them a bunch of breed of vipers, right? That they were turning the church into a marketplace, and that they were doing all the things that we still see regurgitated in religion today. But here's what he did. He'd worked with all the broken. Almost all his disciples were broken men and women that had done all the human things that all of us have done. Been through divorce, had, they'd done all kinds of, the Bible calls it sin. But they were sinners, they were beggars, they were thieves, they were prostitutes, they were all sorts of things. And he brought them in and loved them back to life. And so I feel like that's what I, every day try to do is like, I'm just going to love on the world like he did. And it does make the world a better place. It makes me a better place on the inside. So that's how I think. I think that's what we got to do. We got to love each other back. We got to stop being angry, impatient. We got to start forgiving people. And we've got to really start leading and being the change that we want to see in the world. We have to be it. We can't just want it. It's not something out there. It's right here. So it's like the old saying of be, do, have. If we have to be it, then we have to do it and follow through to have it. And it takes everyone doing their little part, whatever their little part might be, and not giving up on each other so easily. I mean, look at divorce rates, like everything, right? Like the people are just like, they're like, it's like people are a dime a dozen anymore, and we're not, right? We've just been led to believe that we are through the silo that you talked about. And it's the programming. We've been programmed to think that we're separate from each other, when in fact, we all need each other. It's like a human need to connect, right? And we've stopped connecting. And I don't blame anyone. I think each one of us has to take responsibility for that. And that's how we begin to make change, when people are taking responsibility.
And I think we are moving to a level of higher consciousness. Doesn't mean everyone's going to come along, but we're going that direction. The pendulum swings back and forth, and I think we're in for another big swing, but it takes time to have it all come together and bring it.
Yeah, you know what? If we think about even like my undergrad, I did a double major in environmental science and in history. And so I like to look at things through a historical lens for sure. And history works in cycles, right? We create, we maintain, we destroy. So we're at that destruction, right? And we're creating. It's hard. We're living through monumental, like historic times of like entire systems and structures are going to crumble, whether it's financial, educational, health. We're seeing the cracks in the crevices, and they're all kind of crumbling, and people think it's the end and that it's Armageddon and all the things. It's a natural cycle of even a bacteria in a cell. Imagine that we could actually attribute the way a bacteria cycle, create, maintain, and then they all destroy themselves, and then it all happens again. So society's the same, it's just at a big macro level. And so It's hard to watch though. It's hard to be part of. It's difficult, but it's just a natural part of, I think, of living where things have outgrown themselves. In the Bible, they call it the old wineskin. It's done. We're creating new wineskins, right? So we need a new skin so we can carry on with all and grow and learn from everything that we messed up.
And it is like the change of seasons.
Right.
You
Oh, I
go
like
through
that one.
them. It's just natural and you
Yeah.
have to go through them. It's just that most of us don't live through all the seasons because it takes a long, long time for the seasons to come through. And so we forget what it was like 100, 200 years ago. And the seasons do come and go. So little by little, we will get there. What's one truth about success you wish more people understood?
That it doesn't define who you are at your essence. Success isn't the pieces of paper or the trophies. Success is so much more. And really, success can be little wins. It can be the small things.
And it can be. And sometimes we overlook the tiny things, but when you add up a lot of tiny things, they add up to some very big things. What did you learn later in life that you wish you would have learned sooner?
Patience.
I'm
I'm still working on that one.
Yes. That one takes a while.
Right? I think into my fees, learning, recognizing that I could be impatient because I'm a quick study, that one is such an important thing because it makes me a better listener, a better observer, and I get hurt less, even just physically, like, making mistakes. So I'm really being refined in this season on that one.
What I have found when I'm patient, the problem solves itself. I don't have to do anything.
Yes, bravo.
If you were to give an 18-year-old one specific piece of wisdom, what would it be?
Just do the thing. Just do the thing. Don't be afraid. Don't be afraid to fail, right? The only failure is not taking, it's the old adage of like day one or one day. Don't live with one day. Do it.
Just do it.
Yeah.
If people would like to learn more about you, your book, everything else, how do they find you?
Sure. They can visit my website at takebackyourhealth.ca. That's the best place to reach out for me, period. I am on all social media. They can look up at Dr. Jen Hewson or at Take Back Your Health on Instagram. But if they just put in takebackyourhealth.ca, they're going to find all kinds of things, radio appearances, TV. If they just Google me, I'm everywhere. So they'll find me.
Awesome. We'll put that in the show notes. Thank you so much for joining us today.
Rocky, it's been a pleasure. What a great talk. And thanks for having me on.
Hey, thanks for checking out the full unedited video of the Richer Soul podcast. You can get the full audio podcast with intro, outro, and a ton more details here on YouTube or whatever your favorite podcast player is. Don't forget, we've got hundreds of episodes for you to go back through, and you can also get episode information on the Richer Soul website as well. Don't forget to subscribe so you're automatically updated as to what's going on and every time we release a new episode. The first few episodes of the Richer Soul podcast actually lay out the entire framework that everything is built on over all of these years. So check them out as well. Thanks for listening.